Good evening and welcome to another edition of Question Lab. I'm your host, Jeff, and tonight we are going to step you through a set of questions pertaining to reproductive physiology. So haven't tackled this topic in a while, so should be a good session. Um, as always, we've got our special co-host, Dr. Paris Vicaria, to help us break these questions down. Paris, would you like to introduce yourself to the crowd?
Yeah, absolutely. Hey guys, my name is Dr. Vicari or Paris Vicari. I'm one of the dermatology residents here in Dallas, Texas, and I'm also an RX coach with USMLE-Rx. So I work one-on-one with students such as yourselves to help prepare you all for USMLE Step 1, Step 2 CK as well. And I'm happy to help lead tonight's session.
Okay, so uh, you've met Paris. He is one of our RX coaches, and we're going to talk a little bit about RX coach later on in tonight's session. But the one thing I want to point out is that the methodology we use during Question Lab mirrors the methods that our coaches use when working with students. So, part of our process is to really kind of break these questions down methodically and really kind of get help you develop a routine so that you're not having to think about, well, how am I going to answer this question, but that you get into the habit of attacking questions the same way every time. So with that, we're going to go ahead and we are going to uh, go to question number one. The first thing you're going to see when I reveal the question is that there's something missing. And in this case, those are the answer choices, right? So this is a part of our process. So the first two things that we're going to have you do is first, we ask you to cover up those answer choices. We do that because there are going to be a lot of things on step one that you may not remember or that may, could trigger you in some ways. We don't want you to stress yourself out by seeing, something that that you feel like you don't know very well. So we say cover up those answer choices first, and then second, start by reading the lead-in. And the lead-in is the actual question part of a USMLE item. So in this case, the lead-in is which of the following hormones is most likely responsible for a change in body temperature with ovulation? So that's the lead in, and then we go to read the vignette. And in this case, it's a fairly short vignette, but we'll read that now. A young couple trying to conceive comes to the clinic. A friend has suggested that the woman take her temperature daily to determine ovulation. Which of the following hormones is most likely responsible for a change in body temperature with ovulation? So now you've got the vignette, you know what the question is, and I will ask you to let us know in the question box how many steps you think this question is. Do you think this is a one-step, two-step, three-step question? Paris will explain a little bit about the difference between those types of questions as I pass it over to him to take us to the next step. Paris?
Yes, thank you, Jeff. So first, let's take a look at this question. So let's take a look at the important clues in this vignette and the lead-in. Okay, and you can see it's kind of a pretty short question. So, you're going to want to pick up on those important clues there. And they tell us right away, this is a young couple trying to conceive, and then something about taking temperature daily to determine ovulation. Okay, so this is going to require, not a lot of clues here. So we are going to have to draw on our knowledge to hopefully pick up on what's going on here. Okay. Now this question is asking us about the hormone most likely responsible for a change in body temperature with ovulation. Okay. So when we talk about how many steps a question is, basically it's how many questions do we need to answer. So if this was a a question where they were asking us, they gave us some information about a patient and they said, what's the diagnosis? Well, that's probably a one-step question. You just got to put together all the clues and figure out what the diagnosis is for that patient. That'd be a one-step question. A two-step question would be if they said, what is the drug of choice for the disease that this patient has? Well, in that case, one, we've got to answer what is the disease the patient has, and then two, then we've got to know what the drug of choice is for that disease. A three-step question would take it even a step further and say, what is the mechanism of action of the drug of choice for the disease the patient has? So we've got to know, one, the disease, two, the drug of choice, and three, the mechanism for that drug of choice, okay? So if we look at this, we've got this is maybe a little bit tougher to figure out. You could make an argument that this is a one-step question. We know that the body temperature is changing with ovulation, so what hormone does that? There might be more steps in there depending on how you look at it, but I think it's fair to say that this might just be a one-step question, okay? So let's go ahead and let's take a look at those answer choices. And when we see these answer choices, when we work with students, we recommend that students actually start at the bottom or answer choice E, and then work their way up to the top or answer choice A. And the reason we do this is because a lot of times we'll see students who start at the top, they'll select something they like, and they'll pick it without having gone through all the answer choices. So doing it this way, going from E backwards to A, helps prevent you from making that mistake and biasing yourselves. So let's go ahead and let's do that now. Answer choice E, progesterone. D, luteinizing hormone. C, human chorionic gonadotropin. B, follicle stimulating hormone. And A, estrogen. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here. We'll talk about it in just a few seconds.
Okay, so we're gonna open up the poll. Okay, so it appears that the polls were not loaded up. So with that, what I am going to do is I'm going to ask you to go in and let us know in the question box what you think the answer is. And I'll give everybody about 20, 30 seconds, and we'll try to get a read on this. I apologize. I think the polls were, there's just something wrong with the polls tonight. That's okay. We will roll with the punches here. I see a lot of folks are going with D, luteinizing hormone. I see some folks going with progesterone, some folks with estrogen. So got a good mix here so far. And give you guys just a little bit more time. Somebody has changed their answer, so you can do that here. For this one. Let us go ahead and so we're gonna virtually close that poll, and now we're going to reveal the answer. So again, we had a good, it looked like a good mix between folks choosing D and E. Had a few votes for A and a few votes for B, and doesn't look like I saw many votes for C. I saw a couple of C votes. Okay, so with that, let's go ahead and do the great reveal. And the answer is E, progesterone. Okay, so looks like that was probably the leading vote getter tonight, but if you didn't get it, that's okay. Paris is going to be here to walk you through this one. Paris?
Yeah, thank you, Jeff. Great job, guys. So let's talk about this a little bit. So physiologically, what is happening? Well, we know that shortly after ovulation, progesterone is made by the corpus luteum, okay? And it also acts on the hypothalamic thermoregulatory center, thus causing a woman's basal body temperature to rise and change throughout the menstrual cycle. And your basal body temperature for females is a little bit higher during that luteal phase, increasing by about a roughly 1 degree Fahrenheit or 0.6 degrees Celsius. Okay, so a woman can therefore estimate when ovulation has occurred by checking their basal body temperature daily. That's how a lot of people used to do it before technology. So if we go to the next slide, we'll actually take a look at our table on progesterone and first aid, and you can see this, that during the luteal phase, it does a few things. Okay, it works to prepare the uterus primarily for implantation of a fertilized egg if an egg is to be fertilized. And one of the things you can see there is that it increases body temperature. Okay, so one of the functions of progesterone is it works on the hypothalamic thermoregulatory center to increase body temperature. Okay, and that's elevated in the luteal phase because it's being made by the corpus luteum. Okay, now if we take a look at the other answer choices, we can see that those are incorrect. Answer choice D, luteinizing hormone, this is what causes the surge in that hormone, causes ovulation to occur, but doesn't have an effect on temperature itself. HCG, or answer choice C, has no effect on body temperature. Same with follicle stimulating hormone. And estrogen actually can lower your body temperature. So in patients who have low estrogen, like patients with menopause, they can actually have slightly increased body temperature. So estrogen can actually lower your core body temperature. So if you have lower estrogen, you may actually have a slightly higher body temperature. And that can result in some of the hot flashes that patients within menopause experience. So great job on this question. And we will move on to question number 2.
Excellent. Thank you, Paris. And okay, that's a good warm up. And, somewhat straightforward, but just because the questions are straightforward, sometimes the lack of additional of information can add to the challenge. So let's go and take a look at question number 2. So again, very short one, very crisp. Okay, so in this case, again we've got the cover, the answer choices covered up, and the lead-in is, which of the following best describes the normal function of the hormone being tested? Think about that. Think about the information that you're looking for as we read the vignette. A 22-year-old woman presents to her physician with amenorrhea for 8 weeks. A pregnancy test is ordered. Which of the following best describes the normal function of the hormone being tested? Think again. Let us know how many steps you think that it'll take to solve this one as I pass it over to Paris.
Thank you, Jeff. So you can see here we've got another short question here. Okay, and in this case, you generally want to make note of the demographics you're being given in a question. Okay. Now this is not exactly your typical clinical question, but you do want to make note of the fact that this is a 22-year-old woman. Okay. And usually after they give you demographics, they'll tell you why the patient is seeing the doctor, why they're at the hospital. And in this case, it's because she's having amenorrhea. And then a lot of times they'll tell you how long has it been going on for. They'll tell you a couple days, a couple years, so you can get a sense for the chronicity or lack of chronicity of the condition. In this case, they tell us it's been going on for 8 weeks. Okay. And then they tell us a pregnancy test is ordered. Okay, so again, a very short question, getting right to the point, and this question is asking us about the normal function of the hormone being tested and what best describes that normal function. So I think we've got a couple steps here. I think one, we've got to figure out what is the hormone that's being tested? And then two, what is the normal function of that hormone? So I think we've got a nice two-step question here. So let's go ahead and take a look at those answer choices, and let's see what we're working with. Okay, so once again, we are going to start at the bottom and we are going to work our way up to the top. Answer choice E, preparation of the uterus for implantation. D, maintenance of the placenta. C, maintenance of the corpus luteum. B, maintenance of the Graafian follicle. And A, increased prolactin production. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer there. We'll talk about it in just a few seconds.
Okay, excellent. Thank you, Pars. Okay, so we're going to try and see if this works. Okay, the poll has been launched. I believe that is the correct question. So go ahead and make your selection. Which of the following best describes the normal function of the hormone being tested in this case? Again, we often remind you that you should never leave a question unanswered on test day. Definitely don't want to leave a question unanswered during question lab. You are not going to be penalized for guessing, okay? Let's see, about a little over 2/3 of you have voted. I'll give you a couple more seconds. Okay, so let's go ahead. I'm going to close this poll. And we are going to share the results. So pretty convincing lead there for answer choice C, maintenance of the corpus luteum. About a quarter of you opted for maintenance of the placenta, and then in third place, preparation of the uterus for implantation. Okay, so there's the results from the crowd. We're going to hide those results, and let's take a look at the answer. And the answer is answer choice C, maintenance of the corpus luteum. Great job, everybody. That was a convincing answer here from the crowd. So nice work. If you didn't get it right, that's okay. Pars is going to be here to walk you through it. Pars.
Thank you, Jeff. Yeah, so let's take a look at this question. So maintenance of the corpus luteum, okay? The hormone that's being tested when you're trying to detect a pregnancy is HCG, human chorionic gonadotropin, or beta HCG. Okay, it's detectable in blood 1 week after conception and in urine 2 weeks after conception. Okay, so now that we've decided that HCG is what we're testing, we've got to determine the normal function of HCG. So if we take a look at the next slide, you can see in first aid that the main function of the corpus luteum is to maintain that of HCG is to maintain that corpus luteum for the first 8 to 10 weeks by acting like LH. Okay, and the reason it does that, the reason it maintains the corpus luteum is so, as we talked about in question 1, so the corpus luteum can continue to make progesterone, okay, which is needed. Okay, now eventually the corpus luteum degenerates. Okay, but the main function of HCG initially is to maintain that corpus luteum, okay, and thus progesterone. So if we go back to our question, you could see here now why answer choice C is the best answer. Answer choice E, preparing the uterus for implantation, that's talking about progesterone. Maintaining the placenta, that is also progesterone. Maintenance of the Graafian follicle, that is FSH, or follicle stimulating hormone. Then lastly, increasing prolactin production, that is estrogen and also progesterone as well. Not what you test to try to detect a pregnancy. Right, so the best answer choice here, like we talked about, is C.
Excellent. Thank you, Paris. Good job, everybody. Again, off to a good start tonight. I know the first question, we didn't get perfect statistics, but I do think that the majority of you had the right answer there. So for the first half of tonight's question lab, I think you guys are doing great. So keep up the good work. I just want to note that, again, tonight's session brought to you by your friends here at RX Coach. If you are thinking about step one, if you're thinking about, maybe you've got NBMEs coming up, maybe you've got, CBSEs, maybe you're just thinking about, well, how am I going to get to the point where I'm ready for these? Think about RX Coach. We have a system and a process that really is engineered for you, and it starts with a 160 question assessment. It's, obviously that's fairly extensive, but it gives us a good sense of where you are. What do you know well? What are you, where are your strengths? Where are the areas in which you might have some challenges? And we take the results of that, we analyze that, and we use that to work with you to put together a personalized study plan. And we use this isn't going to be a group setting. This isn't going to be like a live, seminar with, lots of other students. You're going to be working one-on-one with a coach like Paris, who's been, trained and RX certified. And on top of that, you're going to have access to, all of the USMLE-Rx tools, including RX 360 Plus and the bricks. So again, if you're getting ready for step one, step two, or any number of the exams that students need to take, COMLEX, obviously, I know we've got a lot of osteopathic students here. We're here to help you prepare and deliver on test day. So the website is rx-coach.com. Put that into the chat, and you can go there and set up a free consult and learn more about the program. Okay, so we're heading into the second half of tonight's lab, and we'll see. Are the questions going to get a little bit more challenging? My guess is that they are, but we'll see how you guys perform. So let's open up question number 3. Again, we've got the question or the answer choices all covered up for you, and we're going to start with the lead-in. Which of the following is the most likely cause of this patient's abdominal pain? Kind of take a good look at that question and think about the type of data that you might be looking to parse as we read the vignette. A 20-year-old woman comes to the emergency department because of a dull, aching pain in her left lower quadrant for the past day. She has not had vomiting, fever, chills, or abnormal vaginal discharge. Her last menstrual period was 2 weeks ago. Her white blood cell count is 9,500 and urine beta human chorionic gonadotropin is undetectable. Pelvic ultrasonography shows no abnormalities. So again, the question, which of the following is the most likely cause of this patient's abdominal pain? Think about that. How many steps do you think this question will require? 1, 2, 3? Let us know down there in the question box as I pass it over to Pars.
Thank you, Jeff. So we'll go ahead and take a look at this question now. So now we've got more of a clinical scenario, a clinical vignette. And we've got a 20-year-old woman. So we want to make note of those demographics, okay? Why is she coming to the ER? Well, dull, achy pain in the left lower quadrant. Very important presenting signs. They also tell us how long it's been going on for, the past day. Okay. They give us some more important signs and symptoms, and they tell us about her menstrual history. Last menstrual period was 2 weeks ago. They give us some lab findings. Okay. And then they also give us some ultrasound findings. So we want to make note of all of those things to try to figure out, why is she having this pain? Okay. So the question, as you can see there, is the most likely cause of the abdominal pain. So this could just be a one-step question. We've got to figure out what's causing this pain. What's the diagnosis here? Okay. So let's go ahead and let's take a look at those answer choices. Once again, we will start at the bottom and work our way up to the top. E, uterine myoma. D, pelvic inflammatory disease. C, ovarian torsion. B, Mittelschmerz. And A, ectopic pregnancy. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here. We'll talk about it in just a few seconds.
Okay, thank you, Paris. So you've got this 20-year-old woman. She's got that dull, aching pain. What is causing that? What is the most likely cause of her pain? Go ahead and take a shot. Even if you're not quite sure about it, take your best shot. Interesting results so far. Looks like we've got another strong favorite amongst this group of answer options. Okay, well, you guys are selecting quickly on this one, so I'm going to go ahead and give you just a couple more seconds and we'll close the poll. Okay, and let's go ahead and share these results. So, gosh, another clear favorite, Mittelschmerz, with 55% of the vote. Ovarian torsion as the runner-up, 20%. Pelvic inflammatory disease, 16%. So again, another clear favorite from the crowd. I'm going to hide those results, and let's go ahead and reveal the answer. And the answer is answer choice B, Mittelschmerz. Nice job, everybody. Again, another, you guys are doing really good tonight. That's 3 for 3 as far as I can tell, at least in terms of the favorites. So nice work. If you didn't get it, that's okay. Pars is going to help you slice and dice this one. Pars?
Yes, absolutely. So once again, let's talk about this question. Kind of not your most common diagnosis, but something that a lot of people experience, okay? So this is a patient, if we take a look at that vignette, who's having abdominal pain, and it's 2 weeks after her last menstrual period. So it's right at the midpoint of her menstrual cycle, okay? So she's having most likely what we call post-ovulation pain, or Mittelschmerz, okay? There's nothing here that points to an infection. Her white blood cell count is normal, no fever, no chills, no abnormal discharge. Her HCG level is normal, so I don't think that this is a pregnancy or ectopic. Okay. We also know she has a normal ultrasound, so we can rule out a lot of those conditions that are also there on the other answer choices. Okay. So Mittelschmerz is basically when you get abdominal pain on ovulation, and it's due to an elevation in prostaglandin release. Okay. Now, if this patient had answer choice E, uterine myomas or fibroids, you would probably detect that on ultrasound. Pelvic inflammatory disease, one that can often be bilateral, and two, I would expect either discharge, fever, or chills, none of which this patient has. Ovarian torsion, that is more of a severe, unrelenting pain, not so much a dull, achy pain. And ultrasound would also show that that ovary is having issues. And lastly, answer choice A, ectopic, also unlikely because of the negative HCGs. The best answer choice here is answer choice B.
Okay, very good. Thank you, Paris. And again, nice work, everybody. That you guys have had a really strong night so far, and we've reached the end. We've reached question number 4. So let's see if we can close just as strong uh, as we've opened here, right? Just as a reminder, we are going to have a raffle at the end of tonight's session, so you do need to be here in order to win. We also have a special offer for those of you here in the crowd. Okay, let us go and open up that final question of the night. Question number 4. Buckle up. So again, the answer choices covered up, and we start with the lead in. Which of the following best describes the normal function of the missing umbilical cord structure? Okay, interesting lead in there. So let's read the vignette. An infant is born at term to a 35-year-old woman after an uncomplicated pregnancy. On examination of the umbilical cord after transection, there are only 2 vessels present. One vessel has a 90% oxygen saturation, and the other has a 50% oxygen saturation. Which of the following best describes the normal function of the missing umbilical cord structure? Think about that. Let us know how many steps you think this one will take to solve as I pass it over to Paris.
Thank you, Jeff. So now this is our 4th time kind of going through this and kind of showing you what we think are those important clues in the vignette and the lead-in. Okay. So now we're talking about an infant. Okay. And so automatically, when you have these pediatric cases, especially newborns and infants, you want to make note of a lot of things. When were they born? Were they premature? Were they post-term? Were they term? What about the maternal history? How old was the mom? Any issues in the mom? Okay. Were there any complications during pregnancy? So, in this case, we're dealing more with the physiology question, so that may not be as relevant, but you want to make note of those when you're going through those questions. Now, in this case, they're telling us that after transection of the umbilical cord, there were only 2 vessels present. One of them had a 90% oxygen saturation, and the other was 50%. So they're asking us about a missing structure in that umbilical cord, and what is the normal function of that structure. So I think we've got a 2-step question here. I think 1, we've got to figure out what is that missing umbilical cord structure, and 2, what is the normal function of that structure. So let's go ahead and let's take a look at those answer choices. And what we see here are 5 choices once again. Once again, we will start at the bottom and we will work our way up to the top. E, transports oxygenated blood from the placenta to the fetus. D, transports deoxygenated blood from the placenta to the fetus. C, transports deoxygenated blood from the fetus to the placenta. B, connects the umbilical vein to the inferior vena cava. And A, connects the fetal urinary bladder to the allantoid. So once again, we're going to go ahead and open up that poll. Make sure you're reading those answer choices very closely. You don't ever want to get tripped up by misreading an answer choice. We'll go ahead and let you select what you think is the best answer.
Excellent. So we've got the poll launched. Go ahead and let us know what you think best describes the normal function of the missing umbilical cord structure. Bit of an unorthodox question, but one that you need to be ready for and prepared for on test day. So let's go ahead and take your best shot at this one. See, about half of you have voted. Give you a little bit more time to make your selection. You guys have done a nice job in terms of just voting tonight. That you guys have been pretty fast in the trigger. So hats off to you. Okay, almost 3/4 of you had voted, so we're going to go ahead and close that poll. and we will share the results. And as has been the case for much of the night, you know, sort of a consensus favorite here. In this case, consensus behind answer choice C. It transports deoxygenated blood from the fetus to the placenta. Sorry that got cut off, but looks like you get about 45% of you were behind that one, and about 1 out of 5 of you were thinking it's answer choice E, transports oxygenated blood from the placenta to the fetus. Okay, so let's hide those results and have our big reveal for our final question of the night. And the answer is answer choice C. So once again, you guys knocked it out of the park. Almost half of you got that one right. Great job. If you didn't get it right, that's okay. You're here to learn. It's much better for you to get the question wrong during question lab than on test day. So if you didn't get that right, that's okay. Parse is going to help you uh, uh, be ready for when you see it the next time. Parse.
Yes, thank you, Jeff. Great job on this question. Another tough reproductive physiology question. Okay, so let's take a look at actually the next slide after the question. Okay, so this is our umbilical cord, and you can see there that there are 3 structures: 2 umbilical arteries and 1 umbilical vein. The umbilical arteries return deoxygenated blood from the fetus to the placenta, okay? While the umbilical vein supplies oxygenated blood to the fetus from the placenta, okay? So we've got 2 umbilical arteries that have deoxygenated blood going away from the fetus. We've got 1 umbilical vein carrying oxygenated blood to the fetus, okay? So our missing structure, we've got to determine what that is. If we go back to our question now, in our vignette, we see that one vessel had a 90% oxygen saturation and the other had a 50% oxygen saturation. So we can determine that that missing umbilical cord structure is probably the second umbilical artery, okay? And as we know, as we said, the umbilical artery transports oxygenated blood away from the fetus to the placenta, okay? Answer choice E is the umbilical vein, which we just talked about, but we are told that's actually there. Answer choice D, this is kind of false. There's nothing that transports deoxygenated blood to the fetus from the placenta. That would not be a good thing. You would not be giving oxygen to the fetus. Answer choice B, this is the ductus venosus, okay? And this does not run in the umbilical cord. Lastly, answer choice A, that's talking about the urachus that connects the bladder of the fetus to the umbilicus. And after birth, this becomes the median umbilical ligament. It's not part of the umbilical cord. Okay. So the best answer choice here is answer choice C. And you can see how they took a kind of a very important physiology concept in reproductive physiology and kind of made it a very interesting clinical question. So a lot of different ways they can ask questions about physiology. So make sure you're up to date on your physiology knowledge, and great job on today's Q-Lab. I will hand it back to you, Jeff.
Excellent. Yes, definitely. You guys did a nice job tonight. Again, there's a lot that you need to be able to understand and synthesize when it comes to repro. So you guys, a lot of you just seemed really locked in tonight. So again, good job. We're always good to see you guys have a good night from start to finish. Again, we have all of the QIDs, all of the ID numbers from tonight's session up here on the screen. So you can plug these into Rx Search within USMLE-Rx. So if you want to dig into them a little bit deeper or look more at the explanations, you can certainly do that. So I'll give you just a second to either screenshot that